Did you know, according to the American Association of Nurse Practitioners, an estimated 270,000 nurse practitioners are licensed to practice in the United States? That's a jump from an estimated 248,000 NPs in March of last year, and is substantially higher than the estimated 120,000 NPs reported in 2007. DNP Sophia Thomas, with our local Daughters of Charity Health Centers, has been named President-elect of the American Association of Nurse Practitioners. So who better than her to tell us about the growing trend of nurse practitioners in our Community Health Heroes report. At the Daughters of Charity Health Centers, nurse practitioner Sophia Thomas is the primary care provider for one-year-old Bianca. As a nurse practitioner, Thomas provides primary, acute, and specialty health care to patients of all ages. Daughters of Charity Health Centers has a patient population of more than 50,000, making it the largest community health center in Louisiana. And Thomas stands at the forefront of a growing healthcare trend.
There's a need for nurse practitioners because there's a primary health care shortage, and access to health care is an issue. You hear stories about people waiting to see their primary care provider sometimes 2 weeks, and they're having acute illnesses. Right now we're in flu season, and if a patient is sick and has flu-like symptoms, they really need to be able to get seen in a timely manner. Certainly at Daughters of Charity Healthcare Centers, we pride ourselves on same-day appointments and giving people that access to care. But there's been an increase overall in the need for nurse practitioners to meet that primary care need that's not being met on a national level.
Thomas practices at the Daughters of Charity Health Centers at 3715 Williams Boulevard in Kenner, and has been named President-elect of the American Association of Nurse Practitioners, where she helps lead an organization representing 270,000 nurse practitioners that handle an estimated 1 billion patient visits annually.
It's truly an honor to serve in this capacity. AANP is the largest professional membership organization for nurse practitioners in this nation. Certainly nurse practitioners are positioned to help us solve the healthcare problem of access, cost, quality for our patients, and I'm truly honored to be in this position to help spearhead that forward as the momentum continues.
It takes about 4 years to become a registered nurse. After several years in the field, RNs can apply to nurse practitioner school. There, they can earn master's and doctorate degrees in about 4 to 6 years and apply for NP certification. Today, 87% of all nurse practitioners in this country practice in primary care.
Certainly nurse practitioners are going into areas that sometimes physicians don't want to go to. We have a lot of nurse practitioners in the rural areas. So access is definitely an issue, and we pride ourselves on providing access to care for people that would otherwise not be able to have it. Certainly you could see a nurse practitioner for any healthcare issue that you see you would see a physician for. Obviously, we don't provide brain surgery, but if you have hypertension, if you have diabetes, asthma, if you're ill, any acute or chronic primary care condition where it's within our scope of practice to treat, and we pride ourselves on treating and then going a step further, looking holistically at your education and being sure that you understand your disease process so you're better able to take care of yourself or your family member and have better outcomes.
Nurse practitioners are not mid-level providers and are expected to meet the same standards of care and competencies as their physician colleagues. They treat the same diseases, and Thomas said their clinical outcomes are equal to and sometimes better than physicians. The 10 Daughters of Charity Health Centers in and around New Orleans offer behavioral health services, chronic illness care, dental, optometry, pediatric, primary, preventative, and prenatal care, and on-site laboratories and pharmacies.
This profession has been extremely gratifying. I've been a nurse practitioner for 23 years, and I've practiced in a variety of settings, mostly in the primary care spectrum, from rural health to community health centers. And I have to say that my relationships with my patients getting to know them, not only their disease and their disease process, but getting to know their family and really looking at them with a holistic approach has really what's made a difference in my profession, in the way I practice, but it's had an impact on the patients and their family members. And it's nice getting to know them, not as patients, but as people. And that's probably the most rewarding thing.